Chapter 9 is front end revenue cycle. There are a total of 33 questions on the test for Chapter 8 and 9. For Chapter 9, there are 17 questions. So we will be describing the processes that are in the front end, financial agreements, schedule and registration, and then talking about patient's financial position. So as we talked about in the very beginning, we learned these two definitions with the bullets: revenue cycle, regular set of tasks and activities that produce reimbursement, and then revenue cycle. Revenue cycle management is the supervision of all the administration and clinical functions that contribute to the capture, management, and collection of patient service reimbursement. So remember that every facility is unique and they can kind of customize these processes the way that they see fit. These are the processes: front end process, which is patient engagement; the middle process, which is resource tracking; and the back end process, which is our claims production and revenue collection. This chapter we will be talking about the front end. The next two chapters we will be talking about middle and back end. But do know that the order is important: patient engagement, resource, and then claims production. So our next slide, and it's kind of covering up a little bit, but I'm going to tell you what that says. It tells us the parts that are under the front end, and you need to know those parts. They are scheduled services, prior authorization if required, registration, and financial counseling. This is all of the pieces and parts that occur during patient engagement. Now, what does it say under there? It says it begins when the patient schedules services, and it ends when the patient registers at the point of care. So it begins when the patient schedules services, and it ends when the patient registers at the point of care. Most of the front end is where we are focusing on complying with regulations and making sure that we have the information we need to get their insurance and that the patient understands what their financial obligations are. So we're going to start with our schedule and service, and the patient's going to start this. And this can be done through a phone call or through a patient portal. A patient portal is part of our electronic health record, and it's a way that we can send and receive information electronically to the provider. Now, in some cases with a portal, you can actually make a doctor's appointment. You can pick a time, pick a date, and then in other cases, you may just have to message to get someone to call you. So it's a wide range of what you're able to do with that patient portal. You can also look to see the cost sharing, remember that terminology is the out-of-pocket cost for that patient. And you can get a pre-treatment cost estimate from a provider. A lot of that does during that initial contact when you're scheduling. Now, as far as price transparency, this is the definition of price transparency is readily available information about the price of services that, together with other information, helps define the value of those services, and it enables patients and other care purchasers to identify, compare, and choose providers that offer the desired level of value. And you need to know that definition of what price transparency is, and it's also on page 170. It is a federal and or state regulation, and it requires providers to make their standard or list prices available. Some states also have it where you can even compare sites. You can put your insurance in, and you can look and see. There is a picture on page 171, that figure 9.2, where it actually shows a comparison for somebody having a colonoscopy, where you can see the cost at different facilities. And we have a homework assignment where we do that as well. Now, CMS has where they have 300 shoppable services that are listed, and these are non-emergency services. They are things that we could schedule to have done. So like an ER service wouldn't be shoppable, but let's say I had to have a chest x-ray. That could be a shoppable service that I could go on and I could see how much it would cost at different facilities for me. So if you look at figure 9.2, page 171, there's that picture. And then let's look at example 9.1. That's on page 172. It says a patient requires an office visit with an allergist. The allergist office notified the patient that the fee for the office visit is $150. The patient cannot determine their cost sharing amount based only on the fee. The details of the insurance coverage, as well as whether the patient met the deductible for the year, must all be known to determine the cost sharing amount. The patient's insurance policy has an allowed amount of $90 for a specialist, a 20% coinsurance, and a $500 deductible. If the patient satisfied the deductible prior to the allergist, then the cost sharing amount would be 20% of $90 or $18. If the patient has only satisfied $400 of the $500 and still has $100 of the deductible to meet prior to the allergy visit, the cost sharing amount would be $90. So remember, with that deductible, you have to get to that deductible a lot of times before you get to your coinsurance. Remember, coinsurance and copay are different. Next is prior authorization. We talked a little about prior authorization, but remember that the doctor requests prior authorization, and this just confirms that your insurance is eligible for that coverage. So we're getting approval from your health insurance before you receive those. And it's also a way of controlling the cost of care, because a lot of times it's used for higher cost services. There are some tips over there that kind of show you the steps. Check that before providing services or sending prescriptions. Establish a protocol to document required. Select the method that will be most efficient. Regularly follow up. When it's inappropriately denied, submit an organized, concise appeal. So remember that when you're trying to get that prior authorization, that you've got their insurance coverage, do they have secondary insurance, who's the guarantor, get all that information so that hopefully that prior authorization can go through. Now, our patient intake, also called our patient registration, this is the time when the patient arrives for the service. In an acute care setting, this is when we are going to register the patient. We're going to educate the patient about their payment. We're going to gather their insurance information. So you can see here we're getting our data, and we're also educating our patient about their responsibility. So we usually get an image of their insurance card. That way, if we need to correct any errors, a lot of times we'll go ahead and get a copy of their picture ID. That confirms their identity, and it's also a way to prevent insurance fraud. We do get a HIPAA authorization form that allows us to claim that service for their insurance. That allows us to send that health information, that private information, so that we can file a claim for them. We do a patient financial responsibility agreement, and this is what helps that patient understand what they're going to be responsible for. So basically, that patient financial responsibility is an agreement between the patient and the provider, so that the patient understands what they're responsible for, and what's not covered by their insurance company. Some facilities will actually ask you to either go ahead and make a partial payment on that, or to make a full payment on that before the service will be provided. But that's the agreement between the patient and the provider, so the patient understands that the patient is responsible for the cost of care not covered by their insurance. And sometimes it may just simply include your co-insurance and your deductible, if you still have that. Next, we have our Medicare beneficiary notices. That's B&I, and there's two of them. We have an ABN and an HINN. An ABN is for outpatient and physician services, and then the hospital, of course, is for hospital inpatient. These are the notices that communicate the financial liability and appeal for patients who have Medicare. This is that patient financial responsibility that's specific to Medicare, and it says what treatment is not going to be covered, and it has to state why it's not going to be covered. If it's never paid for, you don't need an ABN. But a lot of times for lab work, Medicare may only pay for you to have a lab once every 6 months. So it may say that, hey, you're having this lab too early, we're not going to pay for it. It's only been 4 months since you had it. So that ABN is going to say why. It then allows that patient the opportunity to say, yeah, I still want it, but knowing that I'm going to have to pay out of pocket for it. And then this is also a time when we can get counseling to our patients about what they are going to owe. So remember that if you haven't satisfied your deductible, a patient is basically self-pay or self-insured, and deductibles can range anywhere from $200 to $5,000. I mean, just depends on the insurance that a patient has. So patient financial counseling is going to happen in that front end of the revenue cycle in our acute care. And we do that to try to help them make a payment and set up a plan. And we have two examples here. We have the healthcare payment plans. We also have a healthcare loan. Remember that this was in an earlier slide, but just to remind you, amount of money owed by the patient is considered out-of-pocket care. So this is a way of us helping that patient come up with a plan to pay that basically unexpected cost. We also have drug copay cards that helps with high cost of meds. Now, these usually are not available to patients with government sponsored, so sometimes Medicare patients can't get them. And that's due to the anti-kickback statutes that you learned about in your legal class. But they are usually good for people that are uninsured or if you have commercial insurance. All right. A little patient connection. Let's see, did we miss anything? Let me look. Page 174 is an ABN. Let's look at the check your understanding on 9.1 before we look at our patient connection. So in this case, it's asking us, number one, what methods might a patient use to schedule an appointment with a provider? Remember, they can phone in, or they can also use that patient portal. Number two, who's responsible for obtaining that PA, that prior authorization? That's the physician. Number three, what types of data are collected? Remember that we're going to get the insurance, the history and physical. We may get a copy of their insurance. We may get a copy of their ID card. What else was on that slide? I think that's it for that one. How are PAs submitted to an insurance company? Now, it depends on the insurance company. We didn't really talk about this, but you have to know with your insurance company how they want it submitted. It can be through the EHR. It can be through the payer portal, which is kind of like a patient portal, but this is between the insurance company and the physician. It can be electronic. It can be a fax. Very rarely do they put them in the mail anymore, but there may be some. Number 5, when is a provider required to present a patient with an ABN? That's when the service isn't going to be paid for by Medicare. So those are our check your understandings. Okay, so Olivia's husband was prescribed a new drug for his asthma. The drug is not on the super payer formulary, and therefore the copay is 30% of the $3,110. The pharmacist recommended that they search the manufacturer's website to determine if any programs, drugs website, understand the factors. So they were able to locate, and they got a copay card that would reduce the copayment amount to $0 for the drug, and he signed up and he got the card. So in this case, what happened was the pharmacist, whenever they went to get the medicine, did a financial counseling and educated the patient about looking for the copay cards to help with the cost of the medicine. So that is chapter 9. And chapter 9 has no separate any separate little PowerPoints. So let's go ahead while we're here and let's look at the homework. All right. So let's start with this one. And let's go to the qualification for the homework. So this one is our qualification for insurance. So you're working with a new graduate who comments she never did understand various types of insurance and who they typically insure. She asks you to help. So this one's going to require you to go back and kind of look at putting together kind of all of the different pieces and parts. So what I would do is I would kind of look at each one of them separately and take your time and really think about, because by now you ought to have an understanding of the 5 insurance types that are listed here. You have Medicare, Medicaid, commercial insurance, TRICARE, and workers' comp. So if you go through a Medicare, there's an age requirement on them. Medicaid, there is usually an age and a amount of money. There's some requirements as far as certain types of people that meet needs of Medicaid. Commercial insurance is usually attached to a job. TRICARE is attached to the military, and workers' comp means that you got hurt while on the job. So I'm just going to select one of these, and I'm going to say this one. A 64-year-old female with clinical depression. Her husband is a coal miner. Now, 64-year-old female with clinical depression. She's not quite old enough for Medicare. Her husband works as a coal miner, so he probably has insurance through his employer. And I'm not going to play the what if game. I'm just going to say her husband works. She's not old enough for Medicare. I don't know their income. I'm going to say commercial insurance. Okay. I'm going to pick one more, and I'm going to say this newborn born to a mother on Medicaid. Because the mother is on Medicaid, the child is also on Medicaid. Okay, so there's that one for you. 2 answers given to you. Let's move to another one. That was our qualifications. So let's look at this one. All right, so now with this one, this has got different components. And it's taken me through different areas here. So the first thing is perform a web search to find 2 examples of patient responsibility agreements. So I'm just going to web search that, patient responsibility agreements. I'm going to do this. I'm going to copy. I'm going to do this. So here they are, okay? And then it says to compare those, and you can answer the questions to that. Number 2 says understand the steps. You need to put these in order from what we've talked about, okay? The next one is we're going to go to this website, and it asks some questions about this. So let's go to open hyperlink. Yes, I want to open that. So it's asking me to compare the cost, and this is just like we're going to do medical procedures, and we're going to pick an insurance, whatever the instructions tell us. We're going to say we have Anthem NH, and I have individual self-purchased, and it's telling me to search, and it tells me to search for a mammogram, but I'm going to make you do that. So I'm going to search for a chest x-ray. Let's say it's an x-ray of the chest, one view. And then it wants me to enter cost. So I'm just answering questions, and it's telling me the cost. So you're just going to play around with this, determining cost, and you just need to make sure that you are following the directions exactly as they are listed on here. Okay. See, it's telling you mammogram, cost, hospital cost, change it to have no insurance, and it's telling you step by step. So on that one, you have to make sure you're doing exactly what it tells you. That's just a fun site to play around with. So that's that homework. So I'm going to close that one. Let me close this. And it just, remember, it has several different parts to it. Okay. Just trying to make sure we do all the homework. So give me just a second to get my notes straight here. Okay, that was the front end. Now, on this one, if this site doesn't work, because when I click this, it does that, don't stress. Because if you open this up, it comes and it opens from here. I don't know why. So hit open hyperlink, and it comes right here. And you're going to search the physician fee schedule. You're going to come down and hit accept. Now, again, you have all these choices, so we have to look at our sheet and we have to make sure that we're following the directions. So it says we're going to select 2020. We're going to type in exactly word for word. So let me get this. We're going 2020. We want pricing information. We want single HCPCS code. All modifiers, all max. And we're going to enter the here. So I am going to pick one from our table, and it is 4, 3. Well, let's just do the very first one. 12002. Search fees. Okay. I want you to notice that we can move it all the way over. Okay. Move it all the way over. And we're just going to go with this very first one here. We're going to go with the one that is just the generic, doesn't have a locality. We're just going to go with this generic one here. So for it, our non-facility price is 11404. Our facility price is $62.44. We're going to show all columns. Our work RVU is 1.14. Make sure you come up here and hit show all columns. Our fully implemented non-facility PERVU is 1.80. And our MPRVU is 22. Okay, so I got all of that from coming across. Now, let's come here. Let me see if I can make this narrow. So do you see where I'm coming? Let me see if I can go up here. So all I'm doing is filling in this. So my non-facility price, see my MPRVU is 0.22. Fully implemented non-facility PERVU is going to go here 1.8. Then I'm going to have to scroll back. So all I'm doing is filling in these numbers directly from this chart. Okay. And then it's going to ask you some questions. Once you fill in this whole chart, once you fill in all of this, section 1 and section 2, it has some questions that you have to answer about the table. So you have to do this first to answer these questions. And again, remember, if when you go here, it doesn't open, when you open that Word document, right-click on this and it will open. Right-click, open, search, come down, hit accept, change all of this to what's at the top of your Word document, search it, and then make sure that at the top of the page you put all columns so that you can get all of your information. All right, so let's go back to so we talked about the fee schedule, the front end. We talked about our qualifications. So that is all for Module 7. Remember that Module 7, the test has 33 total questions, 16 questions from Chapter 8, and 17 questions from Chapter 9. Please let me know if you have any questions.